Erin, thank you for joining us today to raise awareness of the Day for the Elimination of Violence Against Women. The first thing I'd like to ask you is, how important are days like this?
I mean, it's extremely important. I can't stress how much these sorts of days matter. They provide a kind of a platform so we can highlight issues, and this one is so important. This ongoing, persistent problem of violence against women and girls. It's a public health issue, it's a human rights issue, it's a gender equality issue, and this is the day where we can make everyone sensitized to what's going on. That the estimates are from WHO that almost 1 in 3 girls and women of 15 and older experience some kind of physical or sexual violence in their lifetime. And the violence starts early. Young girls between 15 and 24, the figures are 1 in 4 girls experience intimate partner violence. I mean, the figures are gut-wrenching. And unfortunately, without these days to really call attention, it's hard to keep people's focus on the priority. And now in the global context now with what we're seeing in Ukraine, in Palestine, across the globe, the risk of violence in emergencies is even higher. So we have to be even more having this as a top priority. It's based in pervasive and harmful gender norms and inequalities of power. And this wonderful conference where we met this week, put on by the Secretary General of the Commonwealth, Patricia Scotland, it was a real chance. It was linked to this International Day. That's why they chose the subject, and it's also a passion of hers, but it was another chance to put the issue at the top of the priority list. It was a great conference, and we could look at successes, challenges, good practice, but we need days like this to be able to keep the focus on the issues and also to, I think, recognize our collective responsibility to prevent and eradicate violence against women and girls, which is WHO's position. The full eradication of this violence is the goal, and we really can't settle for anything less. So thanks to these sorts of days that allow us to really focus our attention on the issues of such importance.
Could you tell us about your journey and the work that you do to support the elimination of violence against women?
So most of my career was spent in humanitarian settings, in emergency management for many years in countries, and this issue was sickeningly present everywhere. As I mentioned, the risk is so much higher in emergency settings. But for the last few years, I've been in a different place at WHO. But luckily, I've been able to continue to be involved in supporting this work across the globe. My current job is actually on the broader issues of women's health and gender equality, human rights, health equity, and we now have a dedicated department at WHO for that. But we also have a dedicated department for sexual and reproductive health and rights, and they're doing amazing work on really leading the work for WHO on violence against women. So, our focus at WHO and what I've focused on, even more broadly than violence against women, is the role of the health sector and how the health sector can support women's health. So we look, in terms of violence against women, WHO looks to address it through the health sector, and we emphasize through the health sector prevention. We emphasize training healthcare providers on how to respond. So we look at both the prevention and the response side, and we're working in a number of countries to try to get them to uptake, our guidance, tools, build capacity, etc. And in 2016, actually, WHO's member states endorsed a global action plan to strengthen health systems to respond to violence against women. So, and that's really led by our Department of Sexual and Reproductive Health and Rights. But with our broader look at gender rights and equity, I continue to be involved. I'm really so happy that I still have involvement in this area because of my early work all those years in humanitarian crises. So The action plan calls on all member states to address violence against women and really provide comprehensive services. And that came out a lot at the conference as well, this idea of really ensuring that, which includes, of course, mental health, as well as physical health care. I guess I would just say that, WHO's wider commitment to all these areas, gender equality and human rights and health, I think it's bigger than ever under our current Director General. So it's really I came out of the conference and I continue to have a lot of hope and encouragement by all the great work that's being done. And I think WHO's really put a great prioritization and focus on this work now.
To the individual watching who sadly may well be caught in a domestic violence situation, what would your advice be to them?
Yeah, it's such an important question. And again, the conference highlighted how different every situation is, how different every country's capacity is to handle situations like this. We talked about how healthcare workers need to be trained up. We had people talking about training that's happening with police on how to handle it. Often the health sector is the first responder. It's the first stop of someone who's experienced this. And so it's really up to us to ensure the health system is ready to be first responders. So what I'd like to say is seek help. Go to healthcare should be there to be available to you. But we recognize that we have work to do across the board, all of us, to improve services, to make sure that every person who needs help can get it, and that the various responders, like the police, like healthcare workers, have the training and the capacity to provide for these women and children who need this help so desperately.
Finally, could you tell us about a destination that an individual who is a victim of violence could go to for help and support?
So from the WHO point of view, from what we see, usually the first responder, as I mentioned, is the health system. Usually that's who sees the victim first in many circumstances. So I think that's the idea, that we need to just make sure that health systems are strong enough to provide the services that are needed, both the preventive measures and the response, so that those who are seeking care know that the health system is a safe and trusted partner, and that they can go to them and get the care that they need.
Erin, thank you so much for joining us today.
My pleasure. Thank you for having me.